Have you ever wondered if that nagging pain in your gut could be more than just indigestion? Gentlemen, listen up. Chronic pancreatitis might be silently turning your insides into a ticking time bomb. If you've ever experienced pancreas inflammation, this is your wake-up call. I'm Dr. James from Pancreatic Cancer Warriors, and we're on a mission to arm you with battle-tested knowledge to slay this disease before it strikes. Today, I'm pulling back the curtain on the red flags your doctor wishes you knew about sooner. But before we dive in, here's a shocking fact. 95% of men brush off the number one warning sign as just indigestion. Stick around, and I'll reveal what that crucial symptom is. Let's start with the inflammation trap. Have you been dealing with years of abdominal flares? Each attack is like a stealth bomber, scarring your pancreas and creating the perfect breeding ground for cancer. Don't make the mistake of dismissing it as just another pain episode. Your body is trying to tell you something. Are you listening? Now, let's talk about diabetes. The double agent. Imagine this. You hit 40, and suddenly your blood sugar is all over the place. You might think it's just part of getting older, but what if it's not? Your inflamed pancreas could be waving a white flag, sending out silent cancer signals. It's like a spy in your own body, working against you. Here's where things get even trickier. Have you been losing weight without even trying? It might seem like a dream come true, but hold on. This could be your body cannibalizing itself. Cancer is a master thief, hijacking your metabolism while pancreatitis provides the perfect cover. It's like a burglar robbing your house while you're distracted by a noisy neighbor. Let's move on to pain. The deadly that dull ache that seems to crawl from your belly to your spine. The one you've been blaming on stress. It's time for a reality check. Tumors are crafty invaders, using your nerve highways to turn inflammation into a full-scale invasion. It's not just stress, it's your body's alarm system going off. Now, here's the kicker. Why early detection often fails. There's no routine test for this silent killer. By the time you notice jaundice or severe pain, your survival odds could drop to a terrifying 10%. Waiting is like gambling with your life. Are you willing to take that bet? Let's break down the science for a moment. Why does pancreatitis fuel cancer? It's simple but scary. Chronic inflammation mutates your DNA 40 times faster than normal. Your pancreas is like a fortress, hiding the damage until tumors have outflanked your defenses. It's a sneak attack on your health. But don't lose hope. Knowledge is power, and that's why you're here. Join our brotherhood of survivors. Hit that subscribe button. Every video we release is another weapon in your arsenal. Together, we're turning patients into warriors. Men over 40, listen up. Ignoring pancreatitis is like playing Russian roulette with cancer. It's time to take charge. Screen early. Stay vigilant. I'm Dr. James, and I'm fighting in your corner. Now, let's dive deeper into each of these critical points. Remember, understanding your enemy is half the battle won. The inflammation trap is more insidious than you might think. Each bout of pancreatitis leaves behind microscopic scars. Over time, these scars accumulate, turning your pancreas into a minefield of potential cancer hotspots. It's like repeatedly punching a wall. Eventually, it's going to crumble. Don't wait for the collapse. If you've had more than one episode of pancreatitis, it's time to have a serious talk with your doctor. Diabetes as a double agent is a concept that catches many off guard. Your pancreas doesn't just produce digestive enzymes, it's also your insulin factory. When inflammation strikes, insulin production can go haywire. Suddenly, you're facing erratic blood sugar levels. It's easy to chalk it up to age or diet. But what if it's a warning sign of something more sinister? Regular blood sugar checks are just for diabetics. They could be your early warning system against pancreatic cancer. The weight loss warfare is perhaps the most deceptive symptom. In a world obsessed with shedding pounds, unexpected weight loss might seem like a blessing. But when your body starts burning through its reserves without cause, it's time to pay attention. Cancer cells are greedy, consuming resources at an alarming rate. Meanwhile, pancreatitis can interfere with your ability to digest food properly. It is a double whammy that can leave you wasting away before you even realize there is a problem. Pain's deadly evolution is a journey no one wants to take. It often starts subtly, a twinge here, a dull ache there. But as cancer progresses, it can infiltrate nearby nerves, sending pain signals that radiate through your body. That backache you've been ignoring. It might be more than just poor posture. Pain that persists or changes in character demands investigation. Don't let fear or stubbornness keep you from getting checked out. The failure of early detection methods is perhaps the most frustrating aspect of pancreatic cancer. Unlike other cancers with well-established screening protocols, pancreatic cancer often flies under the radar until it's advanced. By the time obvious symptoms appear, the battle becomes much harder. This is why being proactive about your health is crucial. Know your risk factors, understand your body, and don't hesitate to push for thorough checkups if something feels off. Understanding the science behind how pancreatitis fuels cancer is imagine your DNA as a complex instruction manual for your cells. Chronic inflammation is like repeatedly photocopying that manual with a faulty machine. Each copy introduces more errors, until eventually you end up with instructions that tell cells to grow out of control. That's cancer. Your pancreas, hidden deep in your abdomen, can harbor these changes for years before any outward signs appear. But here's the good news. Knowledge is your superpower. By understanding these warning signs and the mechanisms behind them, you're already ahead of the game. You have the power to be your own health advocate. Don't brush off persistent symptoms. Don't accept it's probably nothing without proper investigation. Your life could literally depend on it. Remember, gentlemen, this isn't about living in fear. It's about living smart. It's about taking control of your health destiny. Every step you take towards awareness and early detection is a step away from becoming a statistic. So, what's your next move? Will you join our community of informed, proactive men taking charge of their health? Will you be the one to spot the early warning signs in yourself or a loved one? The power is in your hands. Let us recap our battle plan. 1. Take pancreatitis seriously. It's not just a one-time inconvenience. 2. Monitor your blood sugar. Unexpected changes could be telling you something important. 3. Pay attention to unexplained weight loss. It's not always good news. 4. Don't ignore persistent or evolving pain. Your body is trying to communicate. 5. Be proactive about your health. Don't wait for obvious symptoms to appear. Remember, in the fight against pancreatic cancer, you are your own first line of defense. Stay informed, stay vigilant, and most importantly, stay alive. Together, we can turn the tide against this silent killer. I'm Dr. James, signing off for now, but our fight continues. Join us in our next video as we explore more strategies to keep you healthy and informed. Your pancreas may be hidden, but with the right knowledge, its secrets won't stay hidden for long. Stay strong, stay informed, and keep fighting the good fight.